am Jennifer Pinnell. I am a senior at Columbus State University, and my project today that I'm presenting to you is on preventing C. difficile in the hospital setting. C. difficile is Clostridium difficile. It is the reason I chose this topic. So the C. diff is a major issue. Also, the death rate between 1999 and 2004 quadrupled. That's some major implications for a need to slow C. diff down. So the goal today is education, research, and develop policies and procedures to prevent C. diff in the setting. And this is where I was just talking about the numbers on the C. diff, and that's quadrupled. What is C. diff exactly? It's a spore-forming bacterial organism that is spread by feces and then to the mouth into the digestion system. It will germinate in the small bowel, and you can be asymptomatic and be a carrier, or you can be symptomatic. The speed by contact, it lives for months on a hard surface. Bleach is what kills it, but it can leave for months. So you can go in a patient room that's been discharged, touch something, wipe your mouth, touch the next patient, and cause some spread. And its incubation period is usually about 2 to 3 days for C. diff. So if you do get infected by it in 2 to 3 days, you will probably start having diarrhea and go from there. Risk factors are people that have been on antibiotics, recent hospitalization, increased age, and proton pump inhibitors, because they reduce the acid in the stomach, which the acid can kill and control the C. diff. So you lose the natural control in your stomach for C. diff. Transmission, like I said, is shed through fecal matter. Main transmission in healthcare is ham, which is, we've got soap, we've got alcohol sanitizer, but alcohol sanitizer does not kill C. diff spores. You need to do old-fashioned hand washing. And environmental contamination can lead to hospital-wide outbreaks, which, we don't even want to go there. That can shut down a hospital, essentially, if you get a full-blown outbreak. Treatments, as a flagyl, vancomycin, which vancomycin works in the oral route for C. diff, not in the IV route. With the oral route, because of the way the body breaks it down, it sits and goes through the gut, actually, itself, and it's more effective. IV route is not effective for C. diff. Then you have Dificid, which is a new antibiotic that's been developed specifically for, I'm not going to try to pronounce the generic name, but it's been developed specifically for C. diff. I also did not get a chance to look up the cost. I'm sure it's major. Surgery to remove portions of the colon, which is an extreme, and frequently it reoccurs even with that. And then FMT, which is fecal microbial transplants, which are being done now. We do them here at Northside with frozen specimens and put those in through a colonoscopy. And the results from them we are seeing results that the patients are getting past their C. diff. Diagnosis needs to be quick. When a patient comes in, if they're having diarrhea, you need to act immediately. They need to be put on contact isolation, and they need to have stool specimens done immediately. And with the contact isolation, glove and gown. Do not have to wear a mask. And of course, diarrhea is defined as if you put the stool in a container, it will take the form of the container. It is liquid. It's not form at all. And this is my little isolation. Stop. We've got bugs. We're going to wear our gloves and our gown. Precautions. Contact isolation again. The glove and gowns are huge. And then the hand washing following. Anytime you go in, out, regardless, wash your hands. If there's no alcohol, if there's no soap and water, alcohol sanitizer is better than nothing, but it's still not going to kill the spores if they're on there. So you would need to use alcohol and just find a sink and use soap and water. I've looked at 3 different studies. One was using probiotics in conjunction with antibiotics to see if that could prevent C. diff. Over the course of the study, they really did not find any solid evidence that that was beneficial. Cost more, but not a solid benefit to give probiotics with C. diff, or with antibiotics, I'm sorry. The next study I looked at was prevention of hospital onset C. diff, which was done in New York metropolitan region using the collaborative intervention model. They found they used the standardized clinical infection prevention cleaning protocols and checklists. The cost savings to them as they implemented this was $2.7 million to $6.8 million cost savings for the New York metropolitan hospitals as they got their numbers down. Again, they went contact precautions, gloves and gowns, sign placement. Make sure you've got your signs on the doors. Make sure people are aware that they've got to wear that gown and gloves and that hand washing is needed. PPE readily available and there. Hand hygiene and private room. There, this goes with any infection. I mean, it's used for C. diff, but it goes with any infection. Come on in. The more the merrier. And environmental, standardized cleaning using bleach-based disinfectants and checklists that they go through, making a specific checklist, especially for terminal cleaning, that we have checked off and we have made sure we've cleaned everything. And then their goal, of course, was to reduce C. diff, and they did at the period. Like I said, they had the savings of $2.7 million to $6.8, which is huge in healthcare. And that affects us all. C. diff affects us all because we're all could catch it without proper hand hygiene, and we're all paying for it in the end. Whether you're in the hospital, whether it's your insurance premiums, that millions of dollars has to be accounted for. So they did have good luck with their collaborative attack on C. diff. And then I also looked at War on the Spore, which was done in a long-term care facility, which long-term care facility patients that are mostly on ventilators coming from other facilities are all very high risk for C. diff. You've got ventilators, they've been in the hospital, they've been on antibiotics. So their risk factors were very high. They also used a comprehensive infection prevention and active surveillance. They focused in on their environmental cleaning. They did what they called the lipstick challenge, which I found very interesting. They went through a patient room and put a lipstick smear on high-touch areas, like door handles, sinks, blinds, like 20 or 30 places that they put this. They had the housekeeping people go in and clean the room. They went in and reassessed to see which lipsticks they missed and used that to educate their environmental services on the importance. I thought that was, I thought that was kind of cool and a good teaching method. Their results at the end of 2 years was their C. diff had been decreased by 44%. And so now the question is, can they maintain that? Because frequently with this study, everybody's very in tune and very on it. And then after that period, people tend to kind of slide again. So the question is to maintain that. So after doing the research, my conclusion is that the collaborative collaboration, planning, education, implementation, and I mean, to me, education is one of the biggest pieces of it. And then implementing the plan that the task force comes up with. I did receive information this week that for our three facilities in our system, this location has the lowest rate of CDS compared to the other three. And we are in the process of forming a task force and looking at all these things. If anybody has any suggestions. And again, step one, wash your hands, soap and water. No alcohol disinfection. Sometimes coming out of the room, that's the only thing there, you gotta use it and go straight to your hands. Contact isolation, rubbing down. When transporting a patient, put the clean blanket over them,